Hi, Chelsea Moore here with Divine Speech and Language Services. Thank you again so much for your inbox comments as well as your questions and your concerns. One of the things that you guys have repetitively asked me about has to do with the way that children understand and the way that they are able to express themselves. A couple of times I've asked parents during evaluations, does your child know what a sock is? Or does your child understand what a shoe is? Or when you give your children directions and instructions, are they able to follow? And parents will always say, oh yeah, she can name a sock or a shoe, or she can tell me the directions and instructions. Well, remember, there are two different sides of the brain that have to do with comprehension and expressive language skills, okay? So with comprehension, it means that you understand what you hear, you're able to process information, you're able to make sense of what you hear, and then you're able to carry out a task. Remember, comprehension is a private event. The only way we understand that comprehension is taking place is if someone shows us. Whereas the other side of that will be expressive language skills. That has to do with what I'm doing right now. I'm talking to you. I'm letting you know what I think about speech and language difficulties. I'm giving you information. I'm using my verbal skills as well as nonverbal skills with my hand gestures. So you have to remember, receptive language difficulties have to do with comprehension, the ability to interpret and process and hear information appropriately, and then show that you can hear those things appropriately by doing. Expressive language has to do with being able to put words together in terms of appropriate form, in terms of the content of a question or a conversation, and use those words accordingly to be able to express needs, wants, desires, opinions, or whatever it is the task may be. Okay, so you got to remember those things relative to receptive language skills and expressive language skills. Also, when your children are getting evaluated by a Georgia licensed speech pathologist or any state licensed speech pathologist, don't forget to ask the severity level of the difficulty that your child might be having. So again, if the speech therapist diagnoses a child with receptive/expressive language disorder or delay, ask the therapist, well, what is the severity level? Does my child have a mild difficulty, a moderate difficulty, or severe difficulty? And then ask that therapist, in a classroom environment, how would my child compared to his or her same age peers, okay? So just remember those things. Those are very important questions to ask. Don't be afraid to speak up and ask those questions. Remember, these are your babies, and you have to make sure that your children get quality care where speech and language therapy is concerned. Remember, for more information regarding our services, visit us online at divinespeech.com. Please check out my YouTube channel at Divine Speech, and also like our Facebook page. Thank you so much.